The World Health Organization called for caution in using artificial intelligence for public healthcare, warning against bias and misinformation in using AI. But where exactly does AI currently stand in healthcare, and what does the road ahead look like? Here to break it all down for us is Yahoo Finance's Anjalee Khemlani. Anjalee, a lot of people had questions about where this could be heading.
Well, we definitely know that the possibilities are endless, but the way I like to say it is that if AI were a human, it would be in college, or at least getting there, thanks to ChatGPT. But in healthcare, there are many areas in AI where it's still basically in daycare. Biotech and medtech are the most advanced right now, with things like machine learning being used for imaging, think X-rays and CAT scans, and then medical devices, so monitoring patients and giving push alerts for when patients need attention. And then lastly, in drug discovery, the most prominent examples of that we've seen in the recent past include Moderna's use of AWS to determine its COVID vaccine formula, and Google launching drug discovery and precision medicine tools for cloud. But even in all these use cases, an adult still has to check the machine's homework. The hope is that one day AI can streamline healthcare. We can already see some of the potential there with companies like Digital Diagnostics, for example, which is an FDA-authorized company that can diagnose an eye disease in patients. Then there's Mass General Cancer Center's AI tool, Sybil, which can detect early signs of lung cancer. There are also tools that are doing the same in breast cancer and brain cancer. And then there are other tools that are working to assist doctors in communicating with patients. A new study showed actually that ChatGPT is more detailed and empathetic than a human doctor, so that's interesting to watch. And then other areas like suggesting therapies and treatment plans based on similar patient data, like we've seen with the U method, which can help create treatment plans for Alzheimer's patients. But relying solely on AI for these uses is a little bit farther off in the distance. One of the biggest hurdles in all this is the siloed way that each sector of healthcare operates. So we know that data stays in the hands of companies or organizations. And so within all of this, that's where some of the hurdles stay. In addition, we know that there's also limitations with the guardrails that are going to be coming up. So tinkering and experimenting with all these is just one way to look at it. Now, we also know that the FDA is one of those. The guardrails that need to be put in, they're currently working on those, but there isn't a concrete market right now for them to wrap the regulations around. And so experts are still wanting humans heavily involved. And it's something we heard from lawmakers as well as experts at the OpenAI hearing yesterday. NYU professor Gary Marcus had this to say.
I think medical misinformation is something to really worry about. We have systems that hallucinate things. They're going to hallucinate medical advice. Some of the advice they'll give is good, some of it's bad. We need really tight regulation around that.
So just like for every other part of it, we know that there are regulations that are still needed and that it's basically all told a long road ahead. Rochelle?
Indeed. I mean, an incredible tool, though, considering where things could go. Anjalee Khemlani, thank you for that breakdown.